and make those embers glow. Yeah, 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 yeah. I'm on my way, and I don't skip a beat. I can't help it, I've got happy feet. So good, I do what I want and it's understood. There's no stopping me when I'm doing my thing. I'm doing my thing. I'ma do me. You know what I mean. I'm on fire. I'm feeling glad there's a spark in my soul. Feel my heart goes zing. I'm clapping my hands and I'm pulling these strings. No stopping me when I'm doing my thing. I'm doing my thing. I'ma do me. I'ma do me. You know what I mean. You know what I mean. I'm on fire. Yes, I am. I'ma do me. I'ma do me. You know what I mean. You know what I mean. I'm on
Christmas time is here, happiness and cheer, fun for all that children call their favorite time of year. Snowflakes in the air, carols everywhere, olden times and ancient rhymes of love and dreams to share. Sleigh bells in the air, beauty everywhere, Yuletide by the fireside and joyful memories there. Christmas time is here, families drawing near, all that we could always see, such spirit through the year. Sleigh bells in the air, beauty everywhere, Yuletide by the fireside and joyful memories there. Christmas time is here, families drawing near, all that we could always see, such spirit through the year. like a rubber. Straight up, I gotcha, making you fall like that. Ooh, when I look in the mirror, I melt your heart in the two. I got the superstar glow, so I step right into my beat. High like the moon, rock with me, baby. Know that I got that heat. Let me show you 'cause talk is cheap. I step right into my beat. Get it, let it roll. Smooth like crochet, you know we don't stop. Hot like ain't no, you'll be like, oh my god. We gon' make you rock and you sing. We gon' make you dance and you say yeah. Hotter, sweeter, cooler, hotter. Get it, let it roll. Smooth like butter, like a criminal undercover. Pop like trouble, breaking into your heart like that. Crochet stunner, yeah, owe it all to my mother. Hot like when you try your best but you don't succeed. When you get what you want but not what you need. When you feel so tired but you can't sleep. Stuck in reverse. And the tears come streaming down your face. When you lose something you can't replace. When you love someone but it goes to waste. Could it be worse? Lights will guide you home and ignite your bones, and I will try to fix you.
Hello everyone, this is Dr. Mark Kwan from Bice Institute. I can't believe that this year is almost coming to an end. I must admit, I'm very much looking forward to the year 2022. In the upcoming year, we have set out an incredibly exciting study club sessions for you. 8 very popular topics. As many of you are already familiar with the format, each session is composed of 3 components: a lecture, a live demo surgery, and a post-surgical discussions. We've designed each and every session to be filled with interactive contents to optimize your learning experience. Each live online study club session starts at 6 p.m. Pacific Standard Time. After each session, a live recording replay will be available for the next 5 days for unlimited viewing. This may be particularly useful for those of you who may not be able to attend live sessions due to geographical time differentials. We also wanted to make these events fun and entertaining as well. So there will be giveaway prizes during these sessions. However, prize draws will only happen during the live sessions. So if you want to win some, you better stay up and show up. Some of the topics for 2022. Session 1, sinus elevation using casket versus DENSA drills. Session number 2, soft tissue augmentation using free gingival grafting by Dr. Bernard Jin. Session number 3, implant complication management. Session number 4, guided bone regeneration using novel approach by Dr. Albert Louis. Session number 5, locator over denture with focus on digital workflow. Session number 6, third molar extraction by none other than Dr. Neki Jamal. Session number 7, guided versus freehand immediate molar therapy. And lastly, to finish the year end with an exciting topic on socket shield therapy by none other than Dr. Jeff Lee from Toronto, Ontario of Canada. I'm sure you will definitely find some of these sessions, if not all of them, very, very educational and clinically useful. Each session qualifies you for 3 AGD credits. Bice Institute Live Online Study Club is a unique, highly interactive implant educational platform, and we are absolutely certain that you will love each and every one of them. Don't forget to sign up for the early bird registration by January the 1st to receive exclusive Bice Souvenir gift set box for the first 20 registrants. So enjoy your holiday season and give yourself a gift of learning. Be safe, be kind, please take care, and we hope to see you soon. Bye.
All right, we're live. Happy New Year, everybody. Oh my goodness. I can't believe that some of you guys actually getting up this early. Probably some of you already have a hungover from New Year's party, home party probably. Yeah, so first time doing a late night coffee show, but which is not really late. Trying to do it early, but not this early. But I decided to do that for a couple of reasons. This way, I can, wish you guys a happy New Year in person. First thing the New Year starts. So it's been a quite a hectic year, wasn't it? Right, for everybody. 2021, and guess what though? Time passes, and before you know it, the year's over. 2021 was quite a big year for me as well. With all the things going through, like you guys, but also I've moved to a new office, which was a big change for me. And it was a struggle, but nevertheless, we're settling in, and I was looking very much forward to 2022. I want to say thank you before I start today's session, brand new session. I want to thank all of you for all your continued support, online and offline. Despite all the changes, we had to make a lot of adaptive changes to curriculum of Bice Institute. But despite all that, many of you travel long distance to come to my offline courses, but also many of you attended my online courses as well. So I just want to give you my sincere thanks to all of you for all your continuing support. Okay, let's talk about today. Okay, what do we have here? Okay, let's go and switch over the camera right here, and let me tell you a little bit about this wonderful gentleman here. Okay, all right, let me go into a PIP mode. Oh, let me go down here a little bit. Okay, all right. Okay. Oh, Albert. Oh my goodness. Okay. How are you, Albert? Okay, I didn't know it was you. I had to look down my phone. I'm just gonna put all the comments down here like this so that. Okay. Good to see you, Albert. Good morning. Must be about what time is it? Over the 8 o'clock, a little over 8 o'clock, 1 hour ahead. Who do we else have? We have Glenn. Good morning, Glenn. We have Joshua. Okay. All right. And Caroline. Okay. All right. Okay. Fantastic. So let me introduce you a surgeon of this morning. His name is Dr. In-Seong Jeon. I call him Dr. John, or some people call him Professor John, because he is a part-time professor in Seoul National University. He does look pretty young here, but he's actually been practicing for close to almost 30 years, from what I know. He's an oral maxillofacial surgeon. He was a key opinion leader for major implant company, including Hyosun, Ostam company for longest time. So he is a good friend with Young-Suk Cho. I don't know if I mentioned before Cho's 52 workflow. Dr. Young-Suk Cho, he's the guy that I've presented one time in Foodstand 52 implants in one day. And I tried to, when we were developing a new clinic, I was modeling after his workflow. I'll cover that sometime in the future, but of course I don't do 52 implants a day, but that's incredible surgeon as well. So anyways, he and Dr. In-Seong Jeon, they're good friends. They've been a key opinion leader, and I had a pleasure of sharing a podium with them at the World Conference a few times as well. So I've presented him through the LCS in the past year, last year, and he is an impressive surgeon. He loads of experience, right? He's done thousands and thousands of implants. But where he really shines is he does presentation on the area that nobody else really does. For example, he did presentation on implant complication pathway. He made an algorithm of how to determine how to remove implants depending on the bone quality, type of implant, and the position of the implant and all that. And some of that I've also incorporated into some of my teaching as well. Today he's going to talk about his approach to a full arch surgery. And what I like about him is, similar to Dr. YK Kim, is that he approaches complicated treatment through a treatment planning of a more of a layperson approach. Like if I were to teach you a full arch, and not many of you guys can really follow it, because the problem is my workflow is based on an in-house dental lab with a few dental technicians, and which a lot of you guys don't have. And my workflow is something that a lot of commercial lab just doesn't have caught up yet, but it will in the near future. So what I'm excited about today is to learn from one of the great, who is Dr. Jeon, but his approach, which I believe is a lot of many of you guys can follow. Okay, so no further ado. Okay, let's start his reaction video today, okay, for me. Actually, you know what? I think I should try to do this open with this one here instead. Of course, this one was previously recorded, right? Okay. There you go. All right. So this presentation, he will be speaking in English. And what I'll be doing is, instead of talking a lot, I'll make some comments. Okay, and just to help you process his approach, because sometimes he talks pretty fast and he does surgery pretty fast. I'm just gonna go forward a little bit. All right. And feel free to ask questions, okay? That's why we do live, right? So that you guys can ask questions, right? Okay. So, all right. Hey, Anis. Good morning. Okay. Fantastic. Okay, I hope everybody can hear me clearly. All right. Bring your coffee. So this surgery was done I think a couple months ago, November, okay, November 11th to be correct, and it was obviously it was sponsored by Megagen and Minek, and they've been putting out really good content, through the pandemic years.
네, 안녕하십니까. 서울 H과 원장 전인성입니다. 먼저 이렇게 메가젠 라이브 서저리를 하는 것을 수락해 주셔서 굉장히 영광으로
Oh, this part he's speaking in Korean. He's basically thanking everybody. He's
Before starting my live surgery, I want to
speaking English now.
give a big gratitude to the Megagen implant for this live surgery. 오늘 수술한 환자분은 58세 여자 환자분이고요. 지금 상하게 어떤 지금 남아있는
58-year-old
발치아들이 있지만 다 발치를 해야 되는
man.
상황이고요. 그래서 오늘은 일단 하악을 먼저 좀 수술을 할 계획입니다.
This patient actually needs a double large top and the bottom.
58, the female patient.
Oh, it's a female patient, sorry.
This patient have some the
I'm a terrible translator.
So today live surgery focused on the lower jaw. So today my plan is the total extraction and then the blue diamond, the bead implant placement. 오늘 수술의 계획은 어쨌든 하악의 임플란트를 6개를 제가 블루 다이아몬드로 식립을 할 것이고요.
Bottom 6
그다음에
implant BDO, blue diamond octa.
복제를 해서 이제 수직 고경과 힐링 스캔바를 인상을 좀 체득할 계획입니다.
Okay, so he'll be introducing a little bit of a digital component to it today.
I want to place the blue diamond implant on the lower jaw, and then right after surgery, I take an impression by the duplicate denture by the healing scan body. That means the implant impression same time simultaneously. The vertical dimension maintained. The Megagen implant에는 굉장히 많은 종류의 좋은
Interesting. I think I'm going to learn something today for sure.
N1, N1H 그리고 블루 다이아몬드가 있고요. 그 중에서 오늘은 블루 다이아몬드를 이용할 계획입니다. As we know, there are many good implant systems in the Megagen implant. The ST implant, N1, N1H, and blue diamond, and so on. So today, I want to select the blue diamond implant. 이 환자의 구강의 사진을 지금 잠깐만 보시면 지금 위아래 리모블 파셜 덴처를 끼고 계신데 굉장히 맞지 않고요. 하악은 굉장히 씹을 때마다 큰 통증을 느끼고 계시죠. 그래서 어쨌든 오늘은 먼저 하악을 먼저 수술할 계획입니다.
Patient is a terminal dentition.
Take a look at this live surgery
Top and
patient.
bottom
This
partial
patient
denture wearing.
has the old-use denture, removal partial, the RBD on the lower and upper jaw. As we can see, the lower jaw.
But the vertical dimensional occlusion, that doesn't look that bad, right? I mean,
the sore spot and some of the mobility. So today the treatment plan is total extraction of the lower jaw and then
he's going to do it's a double arch case, but he's going to do the bottom arch for this session.
미리 CT를 찍어서 우리가 덴처럴 듀플리케이션 복제를 지금 이미 해놨고요. 그걸 가지고 이제 수술할 때 이용을 할 생각입니다. This putty index, this is the conbeam CT. So that means the object CT. So we can make a denture duplication by the conbeam CT. This is the protocol for the one of the digital solution. So today I will use the duplicate denture.
Okay, I'm going to just pause there for a little bit, okay, guys. So again, Dr. Jeon In-Seong is talking a little bit fast. He made a duplicate denture, not from a traditional approach of taking impression and setup and things like that. Or did he do it by doing intraoral scanning? Okay. What he said was he's a cone beam CT. So this is one of the feature of some of the newer generation CBCT, right? Okay. Not all CBCT is built the same, and some of the company, okay. One that I know off my head is a RayScan. Okay, RayScan for sure. RayScan, because I use this option as well. RayScan has an option. CBCT has an option where you can turn the CBCT, okay, cone beam, and from there, right, you can basically turn that into an STL model, okay. And from there, you can literally design your prosthesis, okay, in that. And what I use in our office is we take just a normal impression like a PVS or even just an alginate impression, whatever is good impression, and you can actually take a CT scan of that and you can directly STLize it. And the amazing thing is it's quite accurate. It's really, really accurate. And that's what we've been doing in our clinic, and it's been turning out really, 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 really good. So I think he's going to do something very similar today. And using that, but he's also going to capture not only the, because when you're using a duplicate denture or some sort of a jig, that you're able to capture the video, okay? But in order to reproduce and fabricate a fixed bridge, right? Okay, you need a video, but second information, you need a position of the implant. And position of the implant, he's going to use that by using a scan healing abutment. Okay, I don't know exactly what it is because I haven't used a new type of it, but I heard about it, so I'm excited to see that as well.
이 환자의 파노라마를 좀 잠깐만 볼까요? 지금 보면 하악의 일단 수직골 양은 그렇게 크게 나빠 보이지는 않습니다. 그리고 제가 가장 좋아하는 위치는 역시 6번, 4번, 3번, 3번, 4번, 6번이 될 것이라고 생각을 하고요. Today panoramic view, the vertical abellar bone sufficient is very good. So I don't think today live surgery is difficult. And then my favorite position of the lower jaw, 643, 346. That means the final prosthesis makes 3 pieces. 최종 치료 계획은 아마 3개의 조각으로 나누어서 들어갈 계획이 되겠죠. 지금
So he likes the position of 643, 346. Me, I'm more of a 642, 246 because the honesty is 643, 346 is hard to position properly when you have a 3 and the 4 close together. 342, 246 is easier because I'm not as good of a surgeon as he is.
And then the femur line, the canine area, the crestal dimension is very narrow. So at the time of the surgery, I will determine just whether to go the GBR technique or just the crestal flattening without GBR. Anyway, on the surgery time, I will determine.
So-
이 환자는 지금 아까
So what he's also saying is that he's not going to reduce much bone at all, but where the bony peaks are, right? Okay, bony peaks are, he's going to reduce some of that, and when he does that, his bone quality is pretty good for this case, so he may not even really need to do any GBR, but we'll see.
분들이 6개 임플란트를 신고 이제 여기에 힐링 스캔 바디를 꼽을 거예요.
So he's going to use a healing scan body.
스캔 바디를 가지고 틀니의 복제품을 가지고 바로 인상을 체득하면서 수직 고경을 맞춰갈 계획이고요. 당연히 6일 정도 후에 즉시부하 보철물을
And he's going to, once he does the video registration with the duplicate denture and impression of the healing scan body, then he's going to send to the commercial lab and they're going to make a fixed bridge 6 days later.
Simultaneously, the vertical dimension maintenance, and then 6 days later, I will deliver the immediate rolling. 지금 이것이 이제 저희가 복제해놓은 틀니가 될 것이고 여기 인상제를 넣어서 이것을 가지고 바로 인상을 떠내도록 하겠습니다. Okay, wish me luck, please. 자, 지금부터 수술을 시작하도록 하겠습니다. Now I'm gonna start the today live surgery. 오늘 수술하실 환자분은 말씀드린 대로 58세 여자 환자분이고요. 오늘은 하악의 6개 임플란트를 식립할 계획입니다. As I mentioned earlier, today live surgery patient is 55, the 58, the old female patient. Today I will install the 6th blue diamond implant, the lower jaw. 이 환자의 기존의 틀니를 좀 잠깐 볼까요? 어머니 아이 보세요.
So that's the existing partial, bottom.
어머니 안 물어보세요. This is the old use removal partial denture. So today I make the duplicate denture, the lower jaw already. So I will use this one for the impression taking and then the vertical dimension, the maintain. 이 틀니 복제품을 가지고 힐링 스캡.
So I believe how they made it is by now I could be wrong, but how I would have made a duplicate denture, because some of you guys will ask, is that with the denture in the mouth, you take an impression, PVS impression, and when you remove it, okay, that denture is going to be part of the impression, right? And you take that to a ray scan and you take a CT scan of that. And when you do that, and then you export it as an STL file, that's going to give the shape of it. And with the software, you can basically make the duplicate denture out of that design using a probably ExoCAD or something.
I want to check the occlusion, the duplicate denture. 네, 이 상태가 지금 잘 맞네요.
And of course, he took the impression of the top and the bite, and you can STLize that through a cone beam CT, ray scan, and you are basically digitizing the entire mouth, and you're able to fabricate this. And it's a similar way that that you can make a night guard as well. Print the night guard. So I believe that that duplicate denture is printed. Only difference would be that if I'm doing that workflow, I'll put a marker there so that I can merge the file to a guided surgery. But he's not doing a guided surgery today. He's doing free-handed. Many Korean surgeons in Korea, they don't do guided. Because they're so good free-handed.
The first step of the surgery is the incision. 자, 미드크레스트 인시전 쭉 컨티뉴어스로 인시전을 좀 긋겠습니다. 왜냐하면 지금 어머님 보면 이쪽 뼈가 워낙 얇기 때문에 여기 지혈을 많이 해야 될 거예요. This patient, the lower left side, the crestal dimension is very sharp, so it requires the GBR.
You probably need a GBR or a little bit of alveoplasty. Not to the point of where you need to do FP3, but when it's knife edge like that, you do want to remove about a millimeter
Today,
or
I don't
so.
think it's necessary for the vertical incision of the lower anterior part because of we don't have to find the metal foramen. 단순하게 미드크레스탈 인시전만으로 충분히.
Yeah, he's just doing a mid-crestal incision, the typical. He will locate the mental foramen.
약간의 Y 인시전을 좀 긋을까요?
Yeah, when you guys are doing free-handed or full arch, in my opinion, it's very important that you guys look for the mental foramen.
턱을 목적으로 당겨 주셔요. 그렇지. 플랩 엘리베이션이 제일 먼저 중요한 단계이고.
Full thickness flap.
The first step should be done. Just the flap elevation very carefully.
Very important. Especially if you want to do a GBR. Because what it is, if you able to make a really good full thickness flap on the mandible, a minor GBR, you don't need membrane. Okay.
The guided surgery, so only I have to depend on the analog, the feeling.
I've seen Dr. Jeon use a guided surgical guide before too. But this time he's doing a freehand. Very thin, he says.
The lower left side crestal dimension is very sharp. Maybe it requires some crestal flattening, and then same time the GBR is really necessary.
So he feels that you're gonna need a little bit of flattening. Just enough so that you can get a landing pad going, at least. But he'll also need a GBR as well. That's what he thinks, yeah. So, because of that, getting a full thickness flap is very important. That periosteum, when you do full thickness, that's going to provide initial blood supply. Just want to mention, like when you guys doing a full arches, okay, it's okay to raise big flap, but when you're raising a flap on the lingual, don't go to the floor of the mouth, because if you do that, and as it's healing, the muscle reattachment happens. It could happen more superior, and you end up with a shallow vestibule on the lingual. So when you're raising a flap on the lingual side, you do want to be more careful. Now, first thing that he does, and this is what I recommend, is looking for the foramen. Okay.
여기가 멘탈 잡으세요.
Right there.
여기가 지금 5번 위치가 될 것이고요. 우리가 치면 여기다 치면 1번이니까.
So he's eyeballing where the position of the
로고가 보이고 있고요. 4번은 여기다
6 and the 4 is going to be. So he's going to stay a little bit forward of a mental foramen for the 4 and a little bit behind for the number 6.
어머니 하나 해보세요.
Okay, so he's going to alveoplasty a little bit. This is a cross fissure. He's using interesting. He's using the contra angle. It's similar to the black drill that I use.
ED 4.8을 치는 게 좋겠습니다. 빼라.
It's very important that you don't accidentally grab the thin tissue and then end up rolling into the drill. That can cause a lot of damage. And because he's going to be doing a GBR later on too, he wants to get rid of any of the tissue tags.
을 잡아야 되겠습니다. 자, 가장 중앙에 전체 임플란트 6개의 각도를 지배할 각도 하나를 잡아야 됩니다. 지금 여기가 좀 중앙
So because he's doing freehand, having a mid position orientation
This is the
is very important by creating a reference point.
for the checking the guidance of the angulation of the sixth implant.
So the middle one is not where the implant's going to go, but he's going to put a pin in there.
자, 어머니 살짝 다 물어보세요. 가만히 좀 너무 잡으셨다. 자, 지금 요 정도 각도가
Yeah.
이 전체 각도의 기준점이 되시는지 한번 볼까요?
So this helps him to eyeball what the midline is going to be.
이 얼굴의 정 중앙선 정도, 요 정도
Yeah.
라인은
I mean, this is as analog as he gets, right?
요각도 기준으로 한번 해보세요.
It's old school, Yeah. But if you're good, you're good. I mean, there are those metal guides that Ostam and Nobel sells, even Magagen sells, that has a middle one and has kind of like an arch form, like a bendable metal. I use them. I don't know if Albert still uses them. I use them. I stopped using it because it just got in my way more often than being useful.
여기가 지금 43번이죠. This is the low right side canine.
Oh, he's doing the canine first. Interesting. Okay.
진짜 이 각도를 보고 이런 식으로 와서 이렇게
Because I typically put the molars in first. I would personally do a back and then forward, but he does the front and the back. Yeah, whichever works.
So why
Yeah.
you wanna use this angulation in this manner?
So he's creating a landing peg with the lance. Gotta be very careful. It's a very aggressive drill.
4.1에 10이랑 4.4에 10 준비하라 그래요. 어머니 아 해보세요.
Yeah, Albert, same thing too. He said he used the Nobel the guide and he stopped using it. Yeah. You see that he's using the drills of the BDO kit with a stopper, but he's going deeper than that because he wants to be able to countersink these implants, right?
3.3 드릴로 갈까요?
3.3 drill.
3.3.
Yeah, see that he's going deeper because he wants to follow the Liquivicis rule of the 3 or rule of 4, right? Okay. Thinner the overlying tissue, which it is in this case, the implant has to be deeper, right?
Next drill 3.6, 3.6 트레이닝으로 가겠습니다.
Yeah, 3.6. Yeah, so he's going deeper. Then the stopper will tell you.
후방 쪽에 사악 제1대구치를 드릴링을 해야 되겠습니다.
So he does interesting. He does the osteotomy first before he puts the implant in.
Low right side first molar.
So he's done the osteotomy for the canine,
자, 여기도
first
맹골
premolar,
볼까요?
and the molar.
어머니 고개 아까 왼쪽으로. 그렇죠. 지금 여기 멘탈로가 보이죠? 여기
There's a mental right there. He's gonna go behind.
5번 위치가 될 거니까 여기가 지금 6번이죠. 여기 4.8에 8.5도 준비하고 어머니
Man, this is eyeballing at the finest.
오케이 여기는 8.5 2.5 드릴에 8.5 to 2.5 drill the 8.5 millimeter 이런 장어골들은 버리지 말고요 좀 모아놓겠습니다.
He's collecting this autogenous bone.
during the drilling because this autogenous will be helpful at the time of the GBR.
Because he's forcing that he will need to do a GBR.
Okay, next drill 3.3.
3.3 diameter drill, BDO. These drills are designed to be able to collect bone quite easily. Unlike the Hyasun ET3 drill, the step drills are not good at collecting bone. But step drills cut better, but they don't collect bone. Whereas this BDO, they don't quite cut as sharp as the ET3 kit, but they do collect bone a lot better.
Final drill 4.3. The final drill 4.3.
4.3 is the final drill.
Under drilling.
So he says he's under drilling, so I'm wondering what implant size he's going to put in.
4.4, 4.2 다 주세요.
4.8?
4.8.
4.8 by 8.5. 4.8 by 8.5 BDO. Yeah, you can get quite a bit. Yeah.
초기 고정을 좀 올려야 돼요. 즉시부 하셔야 되기 때문에.
So he wants to make he under prepped it so that he can get the initial osteotomy.
그렇다고 너무 초기 높아지면 안 되죠.
So he's doing a jiggy jacking.
Result.
Yeah.
I think the optimization of the initial stability is the key point.
So what he's doing is a jiggy jacking because BDO it has a reservoir. Okay. So when you go reverse, it cuts the bone reverse as well. So it that way you can reduce the tightness of the insertion. But the BDO though, you have to be careful. It's an octa, it's an edge side wall. So if you do it too much, you can cause a deformation of the connection. So you do have to be careful and make sure that the implant adapter is seated all the way down to the base. Otherwise, you might get a stripping of the connection. So do need to be mindful of it. Okay. He's getting the
4.4, 10 millimeter.
he's getting the next one in 4.4 by 10.
Lower right side first premolar area.
So he's doing the premolar now.
고개 이렇게. 네, 고맙습니다. 이렇게.
Okay, he's keeping as a lingual as possible.
Initial stability looks good.
Okay, good initial stability. Once again, I do wish though they come with the mounts. Okay, I do wish, especially when you're doing a full arches like this. It's really helpful to visualize the
오른쪽 아래 마지막
parallelism.
10mm 들어가겠습니다. The last implant on the lower right side, the 4.1, the 10 millimeter. This is a canine. 초고정 매우 좋고요.
Okay.
I think it's very looks good for a good initial stability for a limit loading.
Uh-huh.
자 여기 그
Yes.
힐링 스캔 바디 6개 까줘요.
And he's asking a healing scan body, 6 of
이런
them.
정도의 스몰 GBR이라면 그냥 힐링 캡 통해서 또는 와이드 커버 캡을 통해서 마무리할 수 있지만 오늘은 인상을 떠서 우리가 즉시 부활해야 되기 때문에 힐링 스캔 바디를 꼽아야 됩니다.
Mm-hmm.
Conventional small GBR usually require the healing cap or wide cover cap, but today I have to use the healing scan body because the immediate loading, the vertical dimension maintenance. 자, 한번 체크해 볼까요?
Yeah, because he's so what he's saying is that he cannot do a true GBR where get a primary closure because 6 days later the patient is expected to get a fixed bridge from a lab, so he has to be able to put this this healing abutment, scan body abutment.
이런 컷이 이걸 우리가 D컷이라고 하는데 이 D컷을 보통 협축으로 만들어 놓는 게 좋아요. This healing scan body have some the Dcut.
Mm-hmm.
This is promise each other between the you doctor and the lab technician. So usually I have some the implicit the promise.
Mm-hmm. So that cut, he calls it a D cut, okay? The directional cut. You want to position in a way that after you place it, it's facing buccally.
이 힐링 스캔 바디는 투피스예요. 그래서 임플란트의 인상 체득이 동시에 대단한 큰 장점을 갖고 있죠. 풀마우스에서 아주 큰 역할을 합니다. I think the most effective the advantage is the healing cap, healing scan body is, especially in the full mouse rehabilitation. So same time, the vertical dimension maintenance, same time the implant impression same time, simultaneously by this kind of the healing scan body. The D컷을 협축으로 하는 게 일단 약속하는 게 좋아요. D공식이랑.
So what it does is this, right? Okay.
I apply the three.
I'm gonna say something. These are not in Canadian market yet, I don't think. Okay, I don't think, I could be wrong. This has two functions. One, it acts like a scan body that you can put in the mouth and scan with the Medit scanner. Okay, but it also functions like a healing abutment, so that it helps the tissue to heal up. Okay, yeah. So you can literally leave that in there for 4 months before you take the scan of this. But what he's using it, okay, he's using it, is he's got hex orientation. So he puts it and makes sure that it is when it puts the scan abutment, the cut is facing buccally, and then he tightens it. Okay, yeah. That gives the orientation, hex orientation, or in this case, octa orientation. Okay, to the lab. And you gotta make sure that it's not hanging up too high, because if you don't profile the osteotomy enough and the healing abutment doesn't sit all the way down, that'll give a wrong orientation of the depth of the fixture, and the bridge that you get, it might not sit properly. Oh gosh, he's touching that with the drill. So scary.
And then this is the first molar area.
Okay.
Initial drill 2.5, 8.5 millimeter. 그다음 drill 3.3. Next drill 3.3. Always remind immediate loading. That means that we have to consider initial stability.
Yeah. He's talking about how important initial stability is.
Next drill 3.9.
3.9 with drill.
And final drill 4.3.
4.3.
final drill 하겠습니다.
4.3 is the final drill, and I believe his final implant is going to be 4.8. And he's checking the depth.
자, 4.8에 8.5 줘요.
Okay, 4.8 by 8.5.
자, 왼쪽 아래 첫 번째 임플란트 들어갈까요?
Getting a good inner stability with any ridge or BDO is quite easy, quite predictable because of the deep thread design, right?
오케이, this is 이거는 4.8에 8.5 BD고요. 왼쪽 안에 첫 제일 대구치 들어갑니다. IPM.
It's the first molar area. He's jiggy jacking. Okay. See that? He's changing the direction, back and forth. Yeah.
만약에 이게 컨벤셔널 로딩을 해야 된다면 그냥 풀 다이아메터 드릴링을 해도 되죠. 그런데 초기 고정을 얻는 게 중요하기 때문에 약간 언더 드릴링을 해야 됩니다. Usually conventional loading doesn't require this kind of the reverse torque for the optimization of the initial stability. But today I want immediate loading, so it requires proper sufficient initial stability. So I want to try initial under drilling, and then I want to make some the reverse torque for the good initial stability.
So what he's saying is that he typically doesn't do this for conventional one-stage approach. He'll go one step higher for the drilling, but because he must make sure that he's get a good torque so that he can support the fixed bridge 6 days later. So he's under prepped. Each of the stereotomy is slightly below.
지금 여기 보면 D컷이 지금 여기 존재하고 있으니까요. 이 D컷을 협축으로 위치시켜 놓겠습니다. 자, 쭉. One more say, this is the promise between you and the lab technician. So usually I have some the implicit promise with my technician. So this is the D-cut.
See that it has a hex orientation, and you're placing a prosthetic screw pin or guide pin in the middle of it to hold that in position. Okay.
자, 좀 어려운 부위로 가겠네요. 자, 드릴링.
I mean that the cut
여기 있는 거 어디 갔니? 뺄 거야.
doesn't have to be on the buckle. I mean, it could be on the lingual, but it's good to be consistent so that your lab technician doesn't have to guess.
이렇게 각도를 두고 이런 식으로 오는 요 느낌을 보시란 말이죠. 링구얼을 보시고요. 링구얼이 좀 언더컷이 좀 있어요.
So he's doing the 3.
With this analog manner, we have to make anyway, without the guide surgery, this is the good treatment for the optimizing of the angulation of the implant. 자, 3.6 드릴링으로 가겠습니다. Next one, 3.6. 여기 4.1을 심을 거예요.
So he's under prepping the 3.6, and he's going to place the implant 4.1.
후방 쪽은 4.4를 심을 건데 여기 참 어렵죠. 이건 이제 어쩔 수 없이 이제 사이드 컷 드릴을 해야 됩니다. 지금 여기가 이제 4번이죠.
He wants to stay in front of the foramen.
그죠? 여기가 멘탈 러브가 지금 보이니까요. 여기 위치에서 여기가 이제 4번으로 들어가야죠.
So that's where the 4 is going to be.
일단 4.1을 전치를 먼저 식립하는 게 낫겠네요. 4.1도.
So he's going to place the implant before he does the other osteotomy on the first premolar.
To the angulation, the control. 자, 4.1이지. 자,
That's a 4.1.
4.1.
4.1 by 10, I think. So he's staying as lingual as possible to create buckle jump gap. So as you can see, he prepped it pretty deep.
자, 이제 뎁스 컨트롤 좀 하겠습니다. 뭐 굉장히 스몰 GBR이죠, 이거는.
Okay. He wants to make sure.
깊게 들어가면 GBR 양이 거의 없어요. 항상 임플란트 드릴링하는 중간에 이 링구알의 언더컷을 꼭 확인해야 돼요. 여기 천공되지 않은 걸 확인해야죠. Always, whenever you drill or implant placement, please check the lingual undercut.
Yeah.
Because we don't want the manual perforation.
Yeah.
자, 이제 드릴링으로 바꿀까요?
Now he's placing the.
사이드컷 드릴을 잘 해야지만 링구알
I mean, he's very experienced, so he's being able to do this eyeballing pretty accurately. But many of us will go have some sort of a direction indicator, right? And the BDO kit, it does come with a direction indicator, so that you can put them on the adjacent implant that's already been placed. That will guide you.
여기는 4.4를 심을 겁니다.
He's going to place a 4.4
The blue diamond implant
BDO,
3.6 드릴링이에요.
and he's going to under prep to a 3.6. Look at the amount of bone he collects. That trail is incredible.
자, 이제 됐습니다. 이걸 마지막 드릴로 해야 되겠네요. 자,
That's the last drill.
Okay, today final implant placement is left. 자, 4.4에 오늘 마지막 임플란트 심겠습니다. 아이고 쉬어요. 사실 사이드 컷 드릴이 잘 되면
21, 24, 35, 40.
스레드 시간이 3개 이하로 줄어들어요.
So he's second assistant. That's all the change for the speed, and she calls out verbally what the torques are as he's placing the implant. Man, he's got good assistance.
This kind of the inclined plane, the final implant depth control, maybe from the lingual wall 1 or 2 millimeter deeper is necessary.
Yeah,
0.5죠. 좀 더 들어가야죠.
yeah. Whenever you're doing inclination implant placement, you want implant to be deeper, at least 1 or 2 below from the lingual bony peak. Okay.
총이 고정은 6개 모두 다 좋습니다. Okay, I finished the implant placement today. 자, 지금 심기 다 마무리했고요. 이제 스몰 GBR을 통하고 이제
Oh, we got more people now.
해야겠죠? 항상 D컷은 더 칼 쪽으로.
Yeah, I appreciate it if you guys shout out. I want to know who's joining us. Yeah, I call this a breakfast club, New Year's breakfast club. See that? Yeah, it's got a deeper cut, the orientation marking, and then you can hex it. You pop it in.
준비해 주세요. 본 매트릭스 준비하고 아까 드릴링 할 때 뽑아놨던 자각으로 좀 먼저 이식할까요? 저기 멤브레인 56 슈어담 있으면 주세요.
So he's going to use the O6 membrane as well.
이게 아까 우리가 드릴링 할 때 제가 모아놨던 자각올인데요. This is the autogenous bone from the drilling. Please collect carefully. This is a very good autogenous bone. You don't have to use another autogenous bone harvesting area. 보면 그 3셀 하나 줘. 여기다 이렇게 리트렉션 걸고 있어. 오케이. 조심하고. 자. 멤브레인 줘. 그거 줘.
I think he's also going to use some commercial bone as well. So from here, it's just a trivial, isn't it? You can use whatever the technique that you use. I mean, many of the bites doctors will use a sticky bone. We use Dr. Bernardin's protocol. White tube, red tube, sticky bone, allograft. In many instances, if the flap is really good, don't even need a membrane with a small amount of the grafting like that.
저기 유니버셜 키트 꺼내줘. 본텍 쓰게. 여기 PRF 좀 줘봐.
Oh, he's doing a PRF as well. Yeah. Sometimes that happens, right? It's hard to reach in.
자, 여기 살라미 줘. 꺼져 하나 줘봐. 이 본 매트릭스는 이미 제가 데이터를 다 갖고 있는데 이거 굉장히 양호한 고리 식재 중에 하나입니다. This is the bone matrix from the Megagen. This is a biphasic calcium phosphate.
Okay. Oh.
The hydroxyapatite is 60%. The beta tissue is 40%.
It's a bony matrix, tricalcium phosphate.
하나면 돼, 하나면.
What I find with the Osix, he's going to try to attempt bone tacking. I find the Osix membrane, it's a good membrane, but it's not very strong. Not my favorite to bone tack it. I tend to tear them. Maybe it's just me.
이럴 때 환자한테 꽉 물고 잠깐 조금만 안 해보셔.
Okay.
움직임을 좀 안 하는 게 좋겠죠? 어머니 좀 톡톡톡 치는 느낌이 드세요.
Okay.
좀 잡을게요.
일반적으로 흡성 멤브레인은 본색 하나만 박으면 돼요. 자, 뼈를 좀 이식하고 이제 봉합을 들어갈까요? 어머니 안 해보셔요.
So he's using a sandwich technique. He put an autogenous bone against the threads, and he's using this artificial bone, bony matrix, as a second layer. Again, there's no right or wrong way. Whatever the your technique follows the concepts of GBR, which is pass rule, right? Okay, maintain the space and good supply and immobilization of the graft. They'll work. Yeah.
제일 가운데 부분을 먼저 한 바늘로 꼬매는 게 좋죠. 위에는요.
You know what I find the membrane that's been really good for my GBRs. I don't know if you used it. Is from Nova Biocare Krios. That thing is like that thing really good. Doesn't tear on me. I usually buy them in bulk once every 3 months or so. Get a bulk discount. And I often get asked question, do you need to remove the bone tags? I try not to if I don't have to go back in.
Due to the bone tag fixation of the lower dam area, I think it's not necessary for the compound suture, just like matrix, matrix, and so on. Because the tension is not severe, so I think just a simple intra-suture is sufficient.
So what he's saying is that if you were not to use the bone tag, he may have had to use tension relieving suture or anchoring suture, but because he put a bone tech here and also the GBR is so small, he's just going to stick to the typical interrupted sutures.
exposure is necessary. 자, 저쪽 왼쪽 아래쪽 뒤쪽. 오케이.
And so also this is very important. What he says here is, be careful with the suturing.
이 힐링 스캔 바디 높이는 7mm짜리고요. 블루 다이아몬드 매가진은 9mm도 있습니다. 그래서 좀 낮다고 판단되면 9mm로 바꿀
Yeah.
거예요, 나중에.
So this is important. So this healing scan abutment, they come in several different sizes. 7mm, 9mm. I think they also have a shorter one. He's using a 7. But if you feel that after countersinking the implant and the tissue rises up, and if you don't see the decut, okay, that indentation when you take the impression in this case, okay, or intraoral scan, if you don't see it, then the lab doesn't know. Then you should change over to something taller, like a 9mm or something like that, okay? So in this case, 7mm should be enough. So, but like you said, okay, it's not the healing abutment that's important. It's that can you give the information to the lab, okay?
So the implant depth, you can finally you can change it just after surgery.
See, that's once you do the suturing, you gotta assess it, right? And make sure that the healing abutment, the indentation is showing, okay? If the tissue is higher than that and the healing abutment gets, the indentation gets submerged, then the lab's not going to be able to make it.
몇 분 지났나요?
He's asking how much time is remaining. So whenever you're doing this type of level of surgery, especially full arches during the limited time,
Test.
it can be stressful, right?
40 minutes. I think it'll be okay. 자, 여기는 지금 그렇게 GBR량이 많지 않아요. 이거는 그냥 PRF로 가도 되겠습니다. 저기. 자, 떼어줘. 어머니 고기 약간 왼쪽으로. 그렇지. 이렇게 스레드가 뭐 조금 노출된 거는 GBR 많이 하실 필요 없어요. 멤브레인 안 써도 됩니다. Just like a small GBR like this situation, only the over contouring of the bone filler and then just a PRF is sufficient. Just like this very small GBR area.
So here he's not going to use the membrane. He's just going to use that, okay, bone filler and a PRF membrane, and then close it up.
봤으니까요. 여기도 약간 좀 뼈를 통렬하게 이걸 우리가 리치 프리저베이션이라고 하는데요. 여기는 멤브레인 넣을 필요 없어요.
Just a curiosity. I don't know why he would not use a sticky bone here, because it would be a lot easier. But I do notice, I don't know why, but a lot of the surgeons who are using a triocalcium phosphate, they don't seem to make it into a sticky bone. When they use an allograft, I've seen a lot of them use a sticky bone, but not this type of bone filler. I wonder why. Yeah.
모양은 조금 더 자연스러워질 수 있으니까요.
I mean, that Professor Son, he loves his CGF and sticky bone, and he pretty much avoids membrane uses unless he needs to, right? Yeah. There's always going to be controversy. Some studies will say that membrane is necessary. Some papers are going to say that it's not necessary. In my opinion, if I'm not doing a periosteal release, I try to avoid using membrane. I don't see the clinical difference. But when I'm doing a periosteal release, like a sausage and a Santa, I prefer to use membrane for sure.
자, 정합할까요? 지금 너무너무 잘하고 계세요. 환자분이 지금 너무너무 잘하시고 계세요.
Yeah.
He's a very excellent patient.
Yeah, he does have a very excellent patient.
조금만 더 참아주세요.
Yeah, it's not easy being a patient at the course, right? Okay. Yeah. So see that the orientation of the flat surface of the skin.
컨디션을 계속 체크하십시오.
Yeah,
Always check. So exposure to decoy or not.
Because especially when you do a GBR like that, or buccal veneer graft. That's what he's doing, is a buccal veneer grafting, isn't it? Right? We call it a BVG. Gotta make sure that
석션해도 될 것 같아요.
it doesn't rise up too high up, because otherwise, when you take the impression or scan, you're not going to capture that information. Now we got 10 people now.
Okay, the remaining suture also, the simple interrupt suture.
Hey Pascal, Nate, Dawson, Raj. Okay, thanks for joining.
여기 석션해요.
Yeah, feel free to leave comments if you have any question.
여기 파티가 다
I think we're almost done with the surgery part.
수술이 거의 마무리가 돼 가고 있습니다. 질문을 좀 준비해 주시고요. Almost done to the live surgery. Please prepare your cushion.
The suture he's using is seems like just the monofilament.
실크 하나 더 준비해 줘.
There's so many good sutures nowadays. It's hard to pick one over the other.
너무 잘 참아줘서 고맙습니다. 잘 참아주셨어. 여기 뒤에 석션해. 아이고 시네요.
Yeah, Albert, I don't know what tech system that was. It did look pretty big. I don't know if it's a screen or actual tech size. That was a good tech though. I mean, it went through D1 bone like it was nothing, right? Because not all tech system can go through a mandibular bone easily.
절대 그렇게 생각하시면 안 됩니다. 일반 부할 때는 틀니를 끼는 게 틀 수밖에 없지만 즉시 부하는 오히려 틀니가 아니기 때문에 GBR 환경에 영향을 미치지 않아요.
So another thing he said is the advantage of immediate loading of a fixture is that it helps with the GBR healing, bone graft healing, because when you are doing a bone grafting and with a denture, is a pressure that causes the bone moves around.
Higher success rate because we don't want some pressure to the GBR area.
But because of the immediate loading, it takes the pressure away from the tissue and the bone grafted area. The success rate of the bone grafting, such as these cases, is much higher.
For a full mouth rehabilitation, in case of the small to the medium GBR, immediate loading is much a meaningful aspect because we don't want the GBR, the pressure and higher success rate compared to the conventional loading.
With the removable, yeah, compared to removable, the fixed loading is much more predictable from a perspective of a tissue and bone graft healing. It really comes down to your ability to work with the lap, though, right? The surgery, as you all know, it's not that hard, right? Surgery is not that hard. If you do enough surgery, you can do this surgery, especially with the surgical guides at your disposal. Surgery is not that hard. The question is the workflow. Because with all this work, if you cannot deliver the prosthesis that you promised, then you failed, right? So now what he's gonna have to check is the exposed surface of the abutment. Okay, scan bodies.
Okay, now I want take an impression by the duplicate denture. 이거 아까 틀리 좀 줘봐요. 지금 이게 어머님 원래 쓰시던 상하 위에 틀리고요. 지금 요게 이제 보면 이렇게 해서 딱 복제가 돼서 지금 그 버티컬 디비전을 잡고 있는 거죠.
So the bottom denture has been fabricated.
이렇게 하시고 이제 맞춰봐야죠. 지금 요 힐링 스캔 바디가 요 안으로 잘 어머니 아예 보세요.
Okay.
Please adapt the duplicate denture for impression taking and then the vertical dimension maintenance. 살짝 다물어 보세요, 어머니. 천천히 다물어. 더 다물어 보셔요. 더. 됐어요.
So he's gonna try to capture that.
보시고 일단 블루무스도 좀.
Not easy to do.
다물고 계세요. 블루무스랑 인상제.
So he's going to capture that with blue mousse, bi-restoration material.
일단 바이트를 좀 잡아드려야죠. 왜냐하면
So he's first going to capture the bite.
어머니 아예 보셔요.
So he's just going to hold that in. So the top part is the shape of the lower teeth before the surgery with the partial denture in. So this whole workflow premises that the initial video is correct, and the fit of the bottom existing partial denture to the top was acceptable. Okay, yeah. So that has to be the premise of a pre-requirement in order to do this workflow.
내면으로 거의 오고 있어요. As you can see, the healing scan body always within the normal limit. On the duplicate denture in the inside, 아이 보세요, 우리. 지금 요 지금 바이트로 갈 거죠. 바이트가 지금 원래
So that's the bite that he has to be true to.
자, 여기 리트랙션 살짝 하고 위로로. 내가 슈린지 줘야 돼.
Now he's going to capture the bottom implant position using an impression.
살짝 호일 리트랙션 하고 있고 내가 이제 뿌리면
Yeah. So he has to make sure that he captures the indentation.
미디움 바디 러버 인상제고요.
Yeah. And you do have to be careful that this impression material does not get under the tissue. Otherwise, you'll get a bone loss. Okay.
어머니 아예 보셔요.
Out of all the steps that he did, this is the most important part. It's not the surgery, it's this. Because you get this one wrong, then
다물어 보셔요.
everything will be off.
됐어요. 가만히 계셔요 이제.
Now he has to stay still.
계셔도 돼. 지그시.
So as you can see, he doesn't need any vestibular impression of the vestibular area. He just needs an implant position area.
And then 6 days later, 6 days, because we have an upper jaw, and today I got a lower jaw impression already, and I have some bite. So from these three information, 6 days later I will deliver immediate loading processes. Thanks, guys.
All right. Okay, let me see. Okay, so that's the surgery, guys. I don't know if there's going to be any Q&A. Let me see. Oh, there will be a post-op assessment in about a few minutes, okay? Any questions so far, everybody? 11 people now. Okay, thanks for joining. Okay, Daniel Kim. Okay. All right. All right, so that was a good surgery. What's been interesting for me the most is the how he uses the scan healing abutment, okay, to capture the bite. Okay.
네, 수술을 무사히 잘 마쳤습니다. 수술 후의 사진을 좀 잠깐 보도록 하겠습니다.
So let's look at the X-ray together.
파노라마에서 다시 한번 리뷰를 좀 간단하게 해보도록
Okay, this was a pre-op panoramic
하겠습니다.
review.
처음에 설명했던 대로 6번 부위의 수직골량이 굉장히 좋죠. 지금 보면 이 수직골량이 좀
Yeah, there has been enough bone behind the mental frame, so we were able to place implant behind the frame,
스몰 GBR로 우리가 마무리할 수 있었고요.
and we were able to do a very small minor bone grafting for the anterior areas.
6개의 BD를 제가 식립을 하였고요. 그 다음에 수술 끝난 직후에 제가 힐링 스캔 바디를 꼽았고, 힐링 스캔 바디에서 미리 틀니를 복제해서 이 틀니 복제한 것이 수직공에 정확히 잘 맞았기 때문에 당연히 잘 맞을 수밖에 없죠. 그래서 그 내면에도 인상제를 넣고 제가 인상을 체득하였습니다. 지금
And he took the impression with the denture duplicate.
지금 제가 식립한 임플란트는 뭐 그런 대로 잘 들어가 있습니다. 물론 각도가 약간 아쉬운 면이 조금 있을 수
He's a little bit unhappy with the direction, but
드리븐이라는 개념이 있고 그 다음에 서지컬 드리븐이라는 개념이 있죠. 이럴 때는 약간 서지컬 드리븐의 개념을 적용하는 것이 좋고요. 왜냐하면 뼈에 어쨌든 많이 잠기도록 식립할 때도 의미가 있고 나중에 스플린팅이 되고 나면 이 정도의 우리가 이제 이걸 컴포트 존이라고 할 수 있는데 이 컴포트 존 내에 들어가 있는 정도의 앵귤레이션의 차이는 전혀 문제가 발생하지 않겠습니다. 지금 제가 CT를 찍어서 캡처를 해서 넣었는데요. 지금 여기 보면 이 30번째는 지금 제가 본텍을 밑에 박았기 때문에
so this bone tag on the bottom.
정확하게 풍요한 뼈를 지금 잘 만들어 놓은 상태가 될 것이고요.
So here is the cross section of where the bone graft are.
스몰 GBR이기 때문에 이럴 때 PRF를 밑에 하나 넣어주면 이렇게 까맣게 보이는 이게 PRF거든요. PRF를 넣어주면 약간의 댐을 만들어내는데 큰 도움이 될 수 있기 때문에 이렇게 해서 간단히 수술을 마무리한 상태입니다.
On the bottom right side, he used a PRF membrane instead.
요거 갖고 이제 우리가 기공실로 보낼 거고요. 당연히 대학
So this is the information he said he's going to be sending, right? Okay, basically, you need a bite. Okay, we need a bite registration, and here is the impression. Okay, underneath the impression of the scan body position. You see that right here? 1, 2, 3, 4, 5, 6 right there. So that's the underside, and that's the top side, right? That's the top side by registration. Okay, yeah. So when you send this information, so what they're going to do is from here they're going to scan that. Okay, they'll be able to scan that and get the information of the orientation of the bottom fixtures, right? The octal orientation as well as the depth. Okay, and also able to get the information of the bite registration, and they already probably have the stone model or the STL file of the upper. So you have all the information to digitally articulate that in the software, okay? Yeah, such as an ExoCAD, okay? To design the framework for the bottom. Only additional information that you would need would be the smile line and all that, but he's making an assumption that the patient's existing smile line determined by the upper is acceptable, right? Like when I'm doing a double large, if they're not acceptable, what I do, I take a facial scan, right? I take a facial scan so that our technician can, okay, either open or close the vertical further or change the midline and all that, okay? And we tie that into a guided surgery as well, okay? Yeah. So what he's showing is probably a simpler version of doing things, okay? Digital workflow, okay? Not every digital workflow has to be fully digital, right? Not all digital workflow has to have guided surgery component to it, right?
해당 임플란트 부위의 인상을 체득했고 동시에 복제된 텔리와 힐링 스캔 바디를 통해서 수직 고경을 동시에 잡아놨기 때문에
Yeah. So he's basically saying that all you really need is the information as a vertical dimension and implant position, right?
커스텀 어바트먼트를 끼면서 제가 다시 한번 즉시 부활을 할 예정입니다. 이 환자는 원래 사실은 상악도 원래 해야 되는데
Yeah.
지금 상악까지를 동시에 해서 제가 아무리 수술을 빨리 해도 40분 만에 이걸 하기 좀 어렵고요.
Yeah, so I mean, like he's saying, that even with the fastest surgery, the reality is that in his own clinic, he'll do this double arch, top and the bottom together. But even with his speed, there's no way for him to do the surgery within 40 minutes, top and bottom arch together, right? Okay, so this is a course, so he had to separate it. Okay, dual arch is possible, okay, but it makes the workflow more complex.
다시 한번 말씀드릴 것이고요. 일단 상악은 여기 이제 치아들 다 뽑을 거 역시 6개의 BD를 제가 식립을 해서
Yeah, on the top, he's planning to do a 6 implant on the BD on the top as well. Yeah.
뭐 질문이 있으면 질문을 좀 받도록 하겠습니다.
All right. That was good surgery, Dr. Jeon. I always enjoy you doing the surgery. Of course, we do things a little bit different. But regardless, I respect what he does and the reason behind that. It's not how you do things, but why you and why you do it. Okay.
포인트 중에 하나가 드릴링이죠. 그래서 드릴링을 정밀하게 하는 것이 중요하고.
And one thing that I do want you guys to appreciate is how his implant, even though he didn't do this guided free-handed, how he's tried to put the implant as lingually as possible right in front of the lingual plate, and that will give enough buccal jump gap space for the buccal veneer grafting. Okay, right? That doesn't matter if how good your grafting technique is. If the implant is too buccally positioned, it's not going to work properly, right? Okay, so the principle has to be followed.
드릴링을 하고 나사서 노출되어 있는 협측에 그것이 스몰 GBR이 됐던 마더리트한 GBR이 됐을 때는 거기에 맞게 간단한 GBR을 마무리하면 되고 풀마우스 같은 경우는 임시 치아가 매우 중요하기 때문에 틀니를 끄는 것보다 하악 같은 경우에는 90% 이상 즉시 부하가 보통 가능하죠.
Yeah, he's saying that how important for him and beneficial for the success of the arch, especially the mandibular arch, is best to go with an immediate rather than delayed denture therapy. So because bone quality is quite decent, the mandible, almost more than 90% of the cases on the mandible, he'd rather go this route of doing a fixed immediate. So I guess for the next 1 week, 6 days, patient doesn't have any prosthesis, will be on a liquid diet. Whereas, you know, if you do have a lap support, then you can get this done within a day or two. In our case, it's a TND, right? That's what we call it, teeth next day, because we make the prosthesis next day and patients without the teeth for 1 day. In this case, is 6 days, I think still acceptable. If you have to go further than that, let's say 2 weeks, then you might be a stretching for the patient to be without teeth for 2 weeks. So you know, again, that's how you want to present the case to the patient, right? Okay, all right, guys. Okay, that's it for the early morning New Year's special event. I might do one more a coffee show live before I get back to the work, but we'll see. Anyways, once again, wish you guys a happy New Year. All right, thanks for joining this morning, and once again, I thank you for all your support online and offline as well. Okay, and be healthy, stay safe. Wish you the best 2022. Okay, happy New Year. Bye bye.